patients need much more than medical care on their healing journey. Their emotional well-being and psychosocial health deserve just as much attention because cancer afflicts the body and alters lives in different ways for different people. This is where CanHOPE, a non-profit cancer counselling and support service by Parkway Cancer Centre, makes a difference.
What we often forget that in the treatment of any patient, it's not just the patient's disease and physical state that we need to focus on, but also in terms of the emotional needs of the patient. And that's why it's so important for us to work with our counsellor, the dietitian, with the nurses and so on, in order to encourage patients. And that's why CanHOPE plays such an important role.
Cancer is not a death sentence. And at CanHOPE, we try to reach out to patients to lend support, and give encouragement and inspiration so that they can fight the disease and be more cheerful and hoping for a better tomorrow.
When patients come with cancer or they think that they are having cancer, they're so scared. They don't know what to do. So what we do in office is try to guide them, try to help them to think what to do.
One of the oncologists, local oncologists, gave us a call. Like, can you please assist this patient? The moment we got the call, immediately went and visited the patient and provided all the information. And of course, I get in touch with the Singapore doctor here as well. Same day itself, we got the reply, okay, what can be done for this patient? So patient had to do a surgery. So Friday we prepared everything, Saturday patient flight, Sunday came in morning, and Monday early morning saw our oncologist and the surgeon, did the surgery. Now the patient is coming back for chemotherapy.
She was a young mother, just gave birth of a child. When she was actually breastfeeding her daughter, and she found that there is a nodule in her breast, and immediately after that she was diagnosed with cancer. So we have sent a report to Singapore to a couple of doctors, and the doctors were saying that if we do the mastectomy now, the baby might be, deprived of getting mother's milk. But there's no way out. The patient came over to Singapore and was treated here in Gleneagles by Dr. Kuki Siong, and got back to her life. And the child is now 3 years old, and the mother and the child is both happy.
Many of the patients, first and foremost, may not speak fluent English, so they have a language barrier, and their local CanHOPE office, the regional CanHOPE office, is able to bridge that gap.
With patients coming from all over the world, CanHOPE has offices set up beyond Singapore to bridge geographical, cultural, and language borders. No matter where they are, our cancer patients know that they have a CanHOPE office to turn to for help and support.
And in addition to talking to the doctors where the time may be constrained, they have another avenue of getting the information to clear the doubts.
The patient and us we are in one team to fight with the cancer.
Because my work is only not work, but I do it with heart.
Even though you're going for a hard time, but this is not end of the world. There is hope.
Touched by hope.